और हमारे कॉलेज की भी लगी थी।
Jadi siapa kinja ya deh.
có dân từ cái thay gì đó चल फिर कल शुरू हो जाए। लोग लगाया है
तो लगाया है, लेकिन जब चलेगा तो लोग लगा के ही चलेगा।
मान लिया स्प्रे
इधर ले आना।
कोई आपका लड़का हो उसको यहाँ जहाँ पे आई लव आई लिखा हो ना यहाँ पे खड़ा कर दीजिए, क्योंकि पता क्या वो सभी यहाँ पे सभी जो आ रहे हैं ना वो मोबाइल लेके पढ़ाते हैं, फिर उसको डिस्टर्ब होता है ना कि मोबाइल से हमारी फोटो खींच लो। कोई आपका लड़का हेल्पर करो ना साथ में खड़ा कर मोबाइल से फोटो। हाँ, और ना इसका आई हिल चुका है, आई लव आई का ना। हाँ, लाइव यहीं पे रखो, यहाँ पे सभी फोटो खींच रहे हैं। यहाँ पे आई लव आई का आई लव आई पूरा मैम सेम
फिजिकल हो गया।
लाइव चल रही है।
याद है यार, उसको लगेगा
ये YouTube पे लाइव चल रहा है, तो आप ही नजर आओगे पूरे। इसमें निकाल के दियो लाइव, ये तो खोला हुआ लाइव निकाल के दियो।
अरे पता नहीं यार इसके पहले
इस नाम से करो उसको अपना उसको
लिंक हो गया कल वाले उसी में चल रहा है।
इसमें चल रहा है। ये तो कल का आज का इसमें कहाँ पे है?
तो देंगे कैसे भैया? आप दोगे कैसे फोटो?
फोटो
नई वेबसाइट पे डाल दोगे क्या? हाँ ये सब
मैम आगे ना करो, लाइव चल रहा है वीडियो। यार यहाँ पे खड़ा करना है,
तो ये आप हमें कैसे दोगे?
आप लोकेश जी यहाँ पे जो इवेंट का देख रहे हैं हमेशा, और उनसे कनेक्ट कीजिए। जो यहाँ के होस्ट है ना, किसी से भी कह दीजिए, वो आपको प्रोवाइड है। बिजी है आप यहाँ
Thank you. എൻ്റെ ടീമുണ്ട് അവരെയും എനിവേ അവരെ അങ്ങോട്ട് വരുമായിരുന്നു
वो तो खिला देगा
भाई कल देखा मैं कितने बजे की 12 बजे 12 बजे की
दिखाइए
छुपके खा ले इसको चांदी की डब्बी को
दिखाई तो नहीं कुछ
कल रात लेट होगी नहीं 12 बजे की तरफ नहीं
घर पे 11:30
11:30 चलो 11:30 कहाँ बंदा ला के देता
एक्चुअली मैम प्लीज वीडियो शूट एक्चुअली लाइव कर एक सिस्टम करना हुआ है वो वेबसाइट बनती है ना बार कोड वाली अपनी वो बना के रखनी है उसमें सारी फोटोज में डालनी वहाँ से लेना स्कैन करो अपना फेस फोटो सारा
हाँ वो ठीक है
वेबसाइट बनानी पड़ेगी आज एक काम करना है यहाँ पे ना मैं एक बंदा एक्स्ट्रा रखना है तो बीच में चक्कर मार लिया ना तो आप खड़े हो गए ये जगह नाश्ता कराएगा फिर ये आ गया
तो पता मैं आज तक भी अच्छा है
आपको करना पड़ेगा और करके पहले भूखे रहते हैं
कुछ नहीं करना है तो आप भाग कर चलो प्लेट करके वहाँ पर टेबल पर जाते थे 2 टेबल प्लेट बना के रखने के बाद कॉन्फ्रेंस स्टार्ट होगी तो फिर अंदर जाएंगे सारे बाय वन गेट वन
कितने स्टील वाले दोनों कितने हैं ये दोनों स्टील लाने ठीक है ये लाइव चल रहा है वो कैमरा यूट्यूब पे लाइव था इसका आपने क्लाइंट से लिंक लिया था हम कल चैनल पे लाइव कर रहे हैं करा उन्होंने नहीं करा उसी में चल रहा है वही सेम उसी में TNAI का बना हुआ है इसको तो ऐसा ना चलो अभी यहाँ वाला कैप्चर करते फिर कुछ स्टेज भी लगा देगा
तक 9 मीटर
दूसरे कैमरे आप रिकॉर्ड कर रही है उसकी रिकॉर्डिंग नहीं होती है ना, तो वो ना अक्सर नहीं आया जैसे कोई क्लैपिंग कर रहे हैं तो क्लैपिंग वाला शॉट आना चाहिए। अब
उसको लोग से बदल जाता है उसको हटाता ना
यहाँ तक कवर कर लेना। एक खाली स्थान थोड़ी देर
वैसे भी है
और आज शाम की रात
नहीं ये वीडियो का दिखनी 65% अभी बैटरी खाना है यहाँ पे
ये चार्ज नहीं है
दो चार दे दो इधर भी ध्यान दे ले अपना इंटरव्यू बाद में कर लूँगा हाँ एकदम सारी डिस्प्ले हो क्या कर रहे हो वो वाले हमारे
मैंने देख लो ये भाई तो अगला देख रहा है होना है
दोनों में आप तो ये करो
उसके बाद नहीं हो रही मेरे को बता
मैं तो यही हूँ भाई मैंने फोटो नहीं खींची
Good morning to all of you. Can I have your attention? Very soon we are going to start. Can all the delegates be inside? I request all to be inside. I request all the delegates kindly come inside. I request all the delegates kindly come inside. We are running short of time.
स्टेबल है।
So, good morning to all of you and a very warm welcome to the second day of 78th National Conference of TNAI 2024. Starting with the activities of the day, we would like to have the plenary session of the day. And to this, we are going to have a virtual message by Dr. Deva very well. And this will brief about Dr. Very well. She is a Canadian American nurse, author, educator, and Lawrence Nightingale scholar. She serves as a volunteer of the International Co-Director of the Nightingale Initiative for Global Health. Holds a PhD in interdisciplinary nursing and international development from Indian Institute and specializes in critical care, women's health, and global health with a focus on global civil society. Regularly serves as a honorary scholar of the Global Initiative on Policy Care. So we are ready to have the virtual message of Dr. Very well.
10 मिनट लगेंगे हो गया।
Hello. Humbly request you all to get down, please. Otherwise, all the program we can take. You can come 1 hour, you can come. This is important.
Actual Trainers Association of India 78th Annual Conference. It's a pleasure to be with you on site. I haven't been able to be with you in person, but here I am on Zoom and I'm so grateful for this opportunity and for being invited by your leaders to bring you this presentation. Nurses' Voice, Grassroots Tonight. For you in the 78th Annual Conference of the Trained Nurses Association of India. I'm Dr. Deva Beck, International Co-Director of the Navigator Initiative. Date 2020. Yes, as we remember, the COVID pandemic began or infected people on cruise ships running across the world in March of 2020. And we also know that 2020 was the World Health Organization's International Year of Nurse and on corresponding plans. But by September of the year, it was going to be an amazing year at any level, but of course, it became a year where we brought everything that we could across a very difficult time. In March of 2020, I was keynoting at the Commonwealth Nurses and Midwives conference in London where many of the leaders, as you have heard there as well. At the end of my keynote, I said, we are on the vanguard of what humanity can become. Little did I know that this would be an amazing challenge, unprecedented. Yes, we do indeed live in turbulent times. And indeed, we continue to care that humanity is suffering from many challenges, including natural disaster, extreme climate events, mass migration, health inequity, the internal conflicts, external conflicts, leading to war. These are global stressors at every level. All exacerbating the precursors to the diseases that we as nurses live with. Of course, we all remember COVID. And since then, of course, the chronic yet increasingly critical global research shortage is worse than ever. The International Council of Nurses has given us a report that says that there will be a shortfall of 13 million nurses worldwide by the year 2030, 5 years away. Many of us are still facing increased challenges and struggling to support others who are affected by their challenge. Still, we are doing this with determination, commitment, compassion, and integrity. With very same attributes, the world needs more, everywhere by everyone. We are leaders demonstrating these attributes. And yes, indeed, we continue as the most trusted and needed profession in healthcare worldwide. We are 80% of the global healthcare burden carried by us in most 70 parts of the world. 80% of the burden. We are sometimes appreciated for service, as indicated by this mural building wall that was painted somewhere in North America. But our public voices are still very good. Albert Einstein is attributed with the idea that problems cannot be solved at the level that created them. We are on the vanguard of what humanity can become. What does this mean? A leading position in the development of something or a group of people who lead the development of new ideas. Then, does this apply to us? Leading position in the development of something, or a group of people who lead the development of new ideas? Here we are at TNAI's 78th Annual Conference. To explore this, we have a bit of related history. In 1973 to 1988, a wonderful director, WHO Director General, Dr. Moore from Denver, he articulated the vision of health for all by 2 facts. Of course, he was criticized for this and widely criticized for this. However, he knew that he was articulating a vision, a North Star here, helping people to think about for all by sometime and aiming toward it even then. One of the things that he achieved with this vision was the amazing Alma Ata Declaration for Primary Health Care that was established by health ministers from around the world at the Alma Ata Conference Center, and then in Kazakhstan, then in Soviet Union, now in Kazakhstan. The Declaration for Primary Health Care, of course, if we had had primary health care as the top way to achieve health since then, since 78, we would have had better health for all by then. We know primary health care is one of the major ways to do this, and we still have the Alma Ata Declaration as our way, our foundation for what we are still working on. Look at our history all the way back to 1948 when the World Health Organization began. Of individuals and states, not just health ministers, not just finance ministers, not just the WHO, not even our state or city municipality leaders. It's dependent on the close cooperation of individuals. And informed opinion and active cooperation on the part of the public are of the utmost importance in the improvement of the health of all people. Does this sound familiar? Active opinion, informed opinion, and active cooperation. These are things we are working on every day when we look at our patient. We are demonstrating the example of the preamble of the WHO all the way back to 1948. And another significant precedence that I love to share is the idea of development support communications, a concept developed by these three United Nations staffers who were friends during their UN time together in the late 1960s and early 1970s. The man on the left, Wayne Kynes, later became my second husband in the early 2000s. But in his 60s and 70s, he was collaborating with his two dear friends, Erskine Childers and Erskine's wife, Malika Badger. The three of them worked on this concept that is amazing precedence for us. For instance, development support communications integrates the United Nations public communications component into development projects that engage and empower field workers and their beneficiaries. This is something here into this public outreach, integrating what we are doing in the field with our beneficiaries, our patients, into the UN's effort to communicate. And I love that this slide is an example of Indian achieving this, in this case, Indian professors at the University of Delhi, working on several issues that the UN is working on still, climate change and food for all. These Indian women are demonstrating the development support communication. And of course, just to say that Wayne lived until 2022, and across the 2000s, he later applied all of these concepts to establish and develop the Nightingale Initiative for Global Health, literally taking this idea forward into what we are working on and achieving today. And of course, once Nightingale anticipated all of this, saying that health is not only to be well, but to use well every power we have. And in that same essay, she said, you must form public opinion. We must form public opinion. And she demonstrated this by writing more than 200 books, pamphlets, and reports on health-related issues, articles for popular journals, newspaper letters to the editor, her notes on nursing that later became a nursing textbook that we still know, was first written as for a general audience for women and girls looking after their families at home. And in the first week of that book's release, 15,000 copies went out across women and girls in Britain. Plus, she wrote 14,000 handwritten letters still available in archives around the world, and these are the ones we have. I believe she must have written more. And so then we are asking, what has she done with you two? What have she done with you two, and what can we do in her name? Health is not only to be well, but to use well every power we have. You must form public opinion. We must form public opinion. An idea that she wrote for us in 1893. So that leads us to the development of the Nightingale Initiative for Global Health. A catalytic grassroots to global international engineering developed across 25 years through workshops, keynotes, webinars, journal articles, textbook chapters, multimedia videos, websites, and UN briefings. And I'm glad to say this includes celebrating with you in Mumbai and in Delhi in 2008. I was privileged to be with you at the Saki Hospital in Mumbai with Dr. Fletcher, and also at the WHO Serial Office, Regional Office in New Delhi. And when I was there, I was with the Regional Nursing Officer, China, and with your leaders from TNAI from that time. And I was also glad to find the Indian National Postage Stamp celebrating the annual 100th anniversary. Based on NAI's people now, we promote global health and well-being in our worldly selves. We engage nurses' voices as our outer self. For our inner self, we encourage self-care, and for our relational self, we celebrate diversity and common ground. These are our 4 advocacy movements. Now, all of this leads to NAI's special consultative status for the United Nations Economic and Social Council. For us, what does this mean? It means that we can bring our collaborative voices, including our collaborators, to United Nations settings and platforms, and to UN representatives, including UN and national ambassadors, high commissioners, and many, many other leaders at grassroots to global levels. This status helps us to bring the grassroots of our voices to global discussions and global arenas. And across 2023 and 24, we shared our Nurses' Voices speaker series featuring nurses from 34 nations in all 6 WHO regions. And this was a collaboration with the United Nations Institute for Training and Research, who gifted us the platform to do this. And the other thing I love to share with you is that this includes leading nurses from 17 Commonwealth nations, and you'll see that I highlighted India, and including the Royal Nursing Advisor at the Indian Ministry for Health and Family Welfare, and also Dr. Deepika Kirkman, and also Dr. Lakshmi Mantrapal, our dear friend and colleague, a leader in Maharashtra, and at the Hinduja Hospital in Mumbai, and also serving since 2008 on the Nightingale Initiative Development Award. So now we're starting a nurses' place, the speaker series outdoors together, with 8 virtual sessions across all 6 WHO regions again. Already featuring 18 students from Brazil, Canada, Philippines, the United Kingdom, and US. Student Nurses Voices Speaker Series will be continuing also co-hosted by the United Nations Institute for Training and Research, and also by Unitized Cycle York Center at the University, at York University in Toronto. York University is gifting us the platform to do this global series. In Africa, we will be hosting African student nurses in January, on January 14th, 2025. In February, we'll be hosting leading student nurses from the Western Pacific region, and please take note of this. We will be working with leading student nurses at WHO Southeast Asian region, including India, on March 11th, 2025. We look forward to collaborating with your leaders and with Dr. Manchikar, our representative in India. We look forward to working with you to identify 9 to 10 leading student nurses from your region. We'll be hosting nursing students from the Eastern Mediterranean region, with a date to be announced in April, and leading student nurses from Europe on May 7th. Nurses' Voices Grassroots to Growth, hosted by the United Nations Institute for Training and Research, demonstrating how our public voices can be heard, listened to, and respected, for the value of our perspectives, for the health of humanity. So, how can we continue? How might we all continue, each in our own individual way? Nurses are oriented to tools and tasks. This we know. Information is our global tool. Information sharing is our global advocacy task. We are an estimated 29 million nurses in the US. Think of it, 29 million. I know that it's more than a million, maybe almost 2 million Indians. Plus, more students and retirees, probably millions more. We are potentially significant voices with our attributes, for the causes we care about, on a sustainable global scale. And this leads me to the Nightingale Declaration for a Healthy World that became NAI's credo when we first began. It was written, crafted by Wayne Kynes as he began established our work, and it's now in 14 language versions with more to come. And now may I suggest that we read this declaration together. I'll read it slowly so that you can take in each of the illustrations and images that are represented and see whether you feel like reading it with me. We, the nurses and concerned citizens of the global community, hereby dedicate ourselves to achieve healthy way. We declare our willingness to unite programs of action, to share information and solutions, and to improve health conditions for all humanity, locally, nationally, and globally. We further resolve to adopt personal practices and to implement public policies in our communities and nation, making this goal achievable and endeavor. Begin today in our own lives, in the life of our nation, and in the world at large. What would Nightingale said to us now? We are on the threshold of mercy. In the future which I shall not see, for I am old, may a better way to be able. May we hope that when we are all dead and gone, leaders will arise who have personally experienced in the hard practical work, the difficulties and the joys of organizing nursing reform, and who will lead far beyond anything we want. Yes, we do indeed live in turbulent times. And we can base our work on the WHO's Constitution preamble. Informed opinion and active cooperation on the part of the public are of the utmost importance in the improvement of the health of people. Informed opinion and active cooperation led by nurses. As we evolve our sense of identity and value to the world, we are on the vanguard of what humanity can become. We are on the vanguard of what humanity can become. Here we are at the Trained Nurses Association of India's 78th Annual Conference in 2024. Thank you so much for inviting me to share with you, for listening to this presentation. It has been a pleasure. I'm very pleased to be representing the Nightingale Initiative for Global Health.
A very warm good morning to each one of you, my dear colleagues and friends. Actually, one of the great pieces of this conference is that she was supposed to be here speaking to us direct face to face. We met here. I have read about Nightingale Initiative for Global Health, but few of us, the national vice presidents, Treasurer and me, were in Malta for the national conference of the Commonwealth Nurses and Midwives Conference. We attended her session on Nightingale Initiative for Global Health. So comprehensive, so holistic, so well-spoken, so communicative. We are all thrilled to hear that from such a gracious face, a very senior nurse. It was so mind-blowing. And immediately after the talk, we invited her and she agreed. And later, the communication was there. Due to the current Canadian-Indian diplomatic issues, there was a problem with visa, but with one letter from TNAI, that was solved. So we are very happy that she has come. She is a very senior person, but then her close relatives objected for traveling to India because the pollution in Delhi, she is such a senior person, they were afraid. She wanted to come to Delhi, Chandigarh, then to go to Bombay also. And finally, this video only came. So few things which I wanted to highlight about Deva Miryapat is she is the co-founder of the Nightingale Initiative for Global Health, highlighting the importance of nurses' contribution and how nurses can contribute to global health in the background of our Alma Ata and the currently called Alma Ata was in USSR, United Sovereign Republic of Russia. Now it is in Kazakhstan and the name change of the place, Almaty. From there she started, that's so comprehensive, every aspect, and she serves as a volunteer in international co-director of the Nightingale Initiative. She has a PhD in interdisciplinary nursing and international development from the Union Institute. She was a clinical nurse. She specializes in clinical critical care, women's health and global health. Recognized as a honorary scholar of the Global Academy of Holistic Nursing. Earned the Distinguished Toastmaster Award and developed music videos with the WHO. She is also specialized in she is honored as a district chair in Rotary International and International Innervale. Why I am saying is she is not only in the nursing field, the nurses concerned citizens for global health and public, the global welfare, that is exemplified through her activities, and we shall not limit our leadership or our contributions only to nursing and health. Global health, welfare of the population of the world is our concern. The nature, the greening of the earth or the global warming, everything is our concern, and because we are the healthcare professionals who constitutes 70 to 80% of the global healthcare workforce. And she told that as far as statistics, now we have 29 million nurses in the world. Of course, more than 3.5 million are from India, though many of them are not in India. So we constitute a large percentage of the considerable percentage of the population of nurse population. And there were two speakers in the program organized by the Global Initiative of Nightingale Initiative of Public Health, Global Health. One was our nursing advisor, Divya Singh Kaka, and second it was Falakshi from Mumbai. And if she was to come, we have planned to have a meeting with all two of them, but that didn't materialize. One thing which she has done, searching for young voices. That's why the student speaker series was started. Many times in nursing, senior people are hesitant to vacate the chair and give to youngsters. True leadership is mentoring good leaders in the second level so that they will come up. And how a visionary global leader is now trying to communicate to the student nurses who are the future of the nursing and the healthcare. These are certain things which we have to learn, and not only just speak from the dais, has to always do in our life. If as a leader of TNAI, if I am not able to hand over this to the next generation, or no, I am a big failure as a leader. That we all should remember. So that's why she said from grassroots to global. The grassroots is that now there are student nurses, and we always say think globally and act locally. But the same thing, she has transformed into the student voices, and of course, we are looking forward to a day with the help of TNAI and SNA, our students also will speak in this global platform as student voice. And another two things are stated, let me tell you. Two things she told. The letters Florence Nightingale wrote on different occasions to the countries in the world. The original letter she wrote to India, regarding India. It is one of the universities in the United States of America. But TNAI could get a copy of it and is there in our National Nursing Museum. And the few words of that she told, the original voice of the Florence Nightingale, recorded by General Electric, which is Thomas Alva Edison's company, the great scientist Edison's company, only recorded voice of Florence Nightingale available in the world. So it is century back where the recording was just done by Thomas Alva Edison's company, General Electric. That voice is there in our TNA's National Nursing Museum. The only place it is available in the all Asia. So this way we have been trying to keep with the TNA, which is continuous journey of 170 years. So this is there in the National Nursing Museum. I am telling you, if as a nurse, as a concerned nurse, any TNA member misses to visit museum, it is a great miss. Everybody cannot listen to the voice which was there in the Florence Nightingale Museum in St. Thomas Hospital, London, and it was closed just with the beginning of the COVID. I don't know whether it is reopened because of financial constraints. And it's not a museum actually. It's a small room where some of the things which are connected to Florence Nightingale is kept. Whereas our National Nursing Museum is of world standard, where you should visit to get inspired and to continue the great journey of modern nursing. That is very, very important. We are really sad that we could not have her here. Maybe she has promised that her visa is for 3 months and she can extend. If there is any other event, when her family permits, she will be. She gave you Malta in a wheelchair. So again, she is ready to come. Hope we will be able to meet her in India and speak to her. Definitely, the next Executive Council of TNA will be. I'm sure they will be happy to organize some event if she is able to travel, where at least the nursing leaders from the different states can come and interact and get new insights about how nurses can directly contribute to global health, not only through bedside care, by influencing policy making, reducing our visibility. It's a very comprehensive, it was a stunning oration. We are at least able to hear it in through a video message, and this message is with TNAI. We'll be happy to share it. Thank you very much. Thank you very much for the patient listening. Hope we will be able to, TNA will be able to continue with such global experts so that our insights and perception about global health, leadership, everything will continue to evolve and develop. Thank you. Thank you.
Thank you very much, sir. And we know that decentralizing our parts is very important. We alone cannot do anything, so it's always good, rather than having centralized things, we decentralize the things. So next on the dais, I would like to invite Dr. Sunil Kumar, who heads the Scientific and Academic Affairs portfolio at Colgate-Palmolive India Limited. He completed his bachelor's in dental surgery and in an MBA in Healthcare Administration from Manipal University in 2011. Over the course of his career in the pharmaceutical industry, Dr. Sunil has gained extensive experience in the field of diabetes, oncology and gynecology, having served as medical advisor at Bayer Health and Novartis Pharmaceuticals. So I would like to invite Dr. Sunil to speak on oral health imperatives, integration of oral health in primary care.
Thank you, Nina ma'am, for the kind introduction. Good morning, everyone, and I'm really privileged and humbled to be breathing the same air as all of you, because I truly consider nursing as a superhero of the healthcare world. At the outset, I would like to congratulate and thank you to the TNAI leadership team, Professor Dr. Roy Johnson, Evelyn ma'am, and Chandra ma'am for giving me this opportunity to connect. Now, I believe no one would have thought that we would be discussing perhaps oral health at this platform when you have much, so as they say that bigger fishes to fry, so you have such bigger critical disease to look after. So in my next 20 odd minutes, I would like to change that perception and perhaps bring to your focus that oral health also deserves a bit of the spotlight which has been missing for a lot many years. And I have realized that being a dentist, and I think a dentistry cannot lead the charge of changing the oral health of the country. It can only be through a larger health workforce who are allied stakeholders and partners, and that's with that intention I would like to start my presentation. Okay. So before we start, just one simple slide on who we are. So I represent Colgate-Palmolive Company. We are one of the perhaps a few handful of companies who have been in the world for more than 200 years. 213 to be precise. In India, we conceptualized way before independence in 1937, and we have 5 factories which produces toothpaste and toothbrushes for the entire Indian population in India. We have one fantastic global research center which is based out of Bombay, and it caters not only to India but also to Southeast Asia, European as well as to the Latin American continent. We are in 4 categories: oral care, personal care, home care and pets nutrition. I'm sure many of you would not be aware of these 4 categories, but Colgate and Palmolive, so that's oral and personal care. But we also are in pets nutrition, that is to the Hills Nutrition company that we operate in. So just a very quick 5-second game for all of you. What's the first thing that you notice in this image? I imagine the tooth is missing, right? I'm not sure how many of you focus, but the eyebrow is also missing of the same guy in the middle, right? So what I want to share with you through this slide is that while oral health is important and the impact is very visible, I don't think any of us would be thinking so much about actually putting efforts and education and counseling on oral health to the community at large. We would be more than happy to spend money on other aesthetic problems, but rather on simple preventative aspects of health and lifestyle. So there's a big huge definition of oral health, and I think medical, we have seen that there are very large definitions of each and everything. But I've highlighted simple 3 keywords in red, which is all it matters when it comes to oral health and in public health. 1, oral health is not just having teeth, but also that it should be functional. Second, there is a very strong psychosocial dimension which is linked or connected to your teeth and oral health, which includes your social esteem, your confidence, and able to operate in your community and society without any comfort and embarrassment. Just like the life sports approach, which I think is a very important pillar in the community and preventive health, the oral health also goes to a life course approach, and at different points in time of an adult, right from infant to geriatric age group, the need changes, the level of services they require changes, and we have to be kind of vocal about it. This is a very interesting data. I'm sure who are into the domains of WHO and very much into the public health aspect, they might be aware of this particular data. This is a list of all the countries issued by the World Bank basis their income. So starting from low income, middle income, upper middle and high income countries. What they did was they listed all the disease that is there in the world in terms of the global prevalence. And well, surprising and not so surprising enough, it is the older diseases which ranks number 1 across all the countries in the world, irrespective of what income of the population they have. So sitting here, we might think that perhaps people living in US or Australia, they might be having less of dental issues. It's not the case. It is ubiquitous. It is kind of present across the world in the same amount of high prevalence. Now let's put some numbers to give a different perspective to this. So, anyone has an idea about how many number of population or we have globally, number of people globally? Well, we have about 8.1 billion to be absolutely precise, and this is, I believe, so the reference is 22, but the numbers are from 24 data September. How many of these people are suffering with oral health or any kind of a diseases? Any guesses? It's exactly half. So every alternate person or that's beside you is having some kind of an oral issue. And we have seen that as the age progresses and as the lifestyle changes, these issues become much more pertinent and prominent in nature. So bringing to the point of why is oral health important? So basis of these numbers shared by the World Bank, shared by different government and NGO institutes across the WHO subsidiary countries, in 2019 a resolution was passed and ratified by the WHO that the risk factors, the commonalities of oral diseases, it shares very strong linkages with NCDs. And hence in 2019 oral diseases were categorized under the NCDs. And because of which the effort was that the amount of government spending is happening on various NCDs a bit of focus should also go on to oral health as well. This is a very interesting data, and I hope you can get the magnanimity of this data. You combine all the other 5 NCDs: mental, respiratory, cardiac, your diabetes or cancers. You keep on one side of the scale, and you keep oral disease on one side. The numbers are higher by 1 billion. So that's the extent of oral health issues we are talking about globally. But why is the issue? Because no one has died of cavities, no one dies of a gum problem. So that's not a big concern for any of us. I mean, if you don't brush for 1 week, we will be able to function the same way as we are. So there is no much attention towards it. And hence the underestimation is so high over here. But of course, we have also heard very common line that dental services are very costly. I don't like to go to dentist. Whenever I go, I come back with more problems and more and more out-of-pocket expenses keeps happening. The reality is that it's a negligence which is the costlier. The more you have in the preventive aspect, you will never have any dental issues ever. I mean, my wife, she has never been to a dentist from the time she was born up till now. And I really envy her because being a dentist, I go so many times to a dentist for my own thing. So that's what happens. Now, when we talk about the impact of oral health on overall health, I'd like to show 3 points. One is on the quality of life, one is on the economic impact, and one is on the clinical impact. And I think the best case study for us is the school children, because they are the people who are, or rather I would say they are the future of the country, of any economy. So we have enough studies to show that the poor oral health in children, they has led to this series of catalytic reactions leading to stunted growth of the individual, all the way leading up to the parents missing their work because they have to be with the child because they're suffering with the swelling, or they're unable because they're irritated, and so on and so forth, which kind of leads to economic burden on the society and the community and eventually to the country. Clinical impact. Oral health, again, there has been enough data to show that oral health has hastened, or it can expedite the occurrence of these diseases. And if they're already there, it can increase the severity of these diseases by 2 to 5x or 4 to 7x in pregnancy and premature birth. So just again a small, very quick activity. If you can please take out your smartphones and just simply scan this QR code. Again, none of my slides are going to be company endorsed or product specific, it's all in health segment. So if you could just please scan this QR code, it will take only hardly 10 or 5 seconds. And you can skip the ad if it comes, it's not by us.
QR code पे थोड़ा zoom कर दो.
It will take you to a website, which is the FDI website. So just like so FDI as a oral health consultants to WHO United Nations. FDI is basically the International Dentist Federation. What Colgate and FDI has worked together is more of like a public health tool. So when you click on the website, it will take you to the website, and there you see this image of this person with the small dots reverberating on different organ system. You click on any organ, what it will show you is 2 things. One, how is the correlation defined between oral health and that particular organ system? Example, let's say if you click on respiratory system, that dot, or you click on the head or the brain system, it will show you the strength evidence-based rating of how your oral health is going to impact your brain health. And secondly, how is this leading to an outcome issue? So it will give you the outcome link impact outcome as well. So this is one of the tools which we are using in different parts of the world, especially in South Africa, under a public health tool where we are running this along with C3, CNMF, these nursing institutions, and along in the Philippines where we are doing with the Philippine Nursing Associations. Now, interesting again on the economic impact. We all know that the costs in India are complete 90% is out of pocket. In fact, not just dental, but rather I would say a lot of medical are out of pocket expenses. When we look at the overall world, the global in nature, it's a staggering $550 billion is being spent on oral health, out of which almost 50% is being or is being spent on cavities alone. Now, putting this context into something which we all relate to is diabetes. Diabetes, one of those conditions where government has always focused on, NGOs has its focus on, so many multi-millionaire companies out there focus on. They have almost a expenditure is about 760 billion. Comparing it with the oral health, where there's hardly any focus, no one is really bothered about it. There is no national policies on oral health for that matter. That's very surprising, but that has been the harsh reality about it. So that's the level of economic impact we're talking at a global level. So the red words are the most important. The dental diseases are 100% preventable, including to a large extent oral cancer. They are absolutely preventable. So how can we address this huge burden? One of the area I feel, when I say I mean to say Colgate Global India, we feel is the presence or a strong preventive actions in the range of maternal child health, or rather I would say maternal child oral health. Because we have been talking too much on MCH, but the oral health has been largely deleted or not seriously paid attention to. Why does it matter? Because pregnancy and those times are very critical times when it gives us an opportunity to change the behavior of a person. I mean, if I go and talk to any adult at this point in time, I may not be able to bring a behavior change. But during pregnancy, I'm having a person who is who is really optimistic to give the best of the health and best of everything to the newborn child. So if I'm able to give a right education to that mother or the to-be mother, I can absolutely ensure a better health for the newborn as well. And we have again enough evidence to show that a better oral health status of the mother is equal to a better oral health status of the child. So key touch points that we have discovered is expected mother, new mothers, infants with milk teeth, and infants all were transitioning to a permanent teeth. And I think we should really stop saying that line that these are milk teeth, you can safely ignore it, let it rot, it's okay, you're going to have permanent teeth. Because that's no more true. It is going to impact on permanent teeth. So in a pregnant woman, I'm not sure how many of you have seen such images in actual patients. But these are very common. I mean, I would say 1 in 4 pregnant ladies who have such kind of oral health issues. And again, these are absolutely preventable. It's not going to stay for the whole of 9 months or even 1 year, 2 years later on. But the point is here is that it should not have been occurring in the first place. And the simplest treatment of all of this, if you're not dealing with a simple scaling or a simple cleaning of your teeth, and nothing of this would kind of happen. A lot of pregnant, we have seen a lot of vomiting, gastroesophageal reflux happening. And by simple restorative treatments or repair treatments, these wearing down of teeth can be stopped completely. Because once a tooth enamel and the dentine has been lost by acid, you cannot grow it back. You can only put crowns and caps and so on and so forth, but that's never going to replace your actual teeth ever. So, and all of these are absolutely preventable. It just needs like one session of 30 minutes at a dental clinic during the prenatal checkups. And that is what we have been asking a lot of governments to do, that when you're having a prenatal checklist, just ask them to visit a dentist. Any dentist, public, private, doesn't matter. It will hardly take half an hour for them to get this thing done. And of course, I'm sure you all will be aware that we have now well-documented data that how dental diseases is going to impact significantly your birthing outcomes, leading to preterm birth, leading to very low birth weight condition, preeclampsia and so on and so forth. A lot of us don't talk about it because we always try to look at the medical reasons for why all these issues happen, but the real reason might be somewhere in a oral cavity, which even the mother and the doctors may not be well aware of. So what we are trying from our side is that we are not just reaching out to the dentist, we are also reaching out to the gynecologist as well as obstetricians, the Foxy Association, in terms of having these things kind of addressed in their general education components. In a new mother, vertical and horizontal transmission, we normally have our grandparents saying that don't kiss the child on the lips. The reason for it is that, there is a scientific reason for also is that because when you do that, there is a vertical transmission happening from mother to the child. The mother, you might think that the child has come out from a mother's womb, so the microorganism should be safe. Yes, to a large extent, yes. But the amount of certain microorganisms like mutants and all, which is responsible for cavities, they are in the more quantity in mother's mouth. And every time when there is a transmission happening to a child, the risk of the getting cavity in a child's mouth increases 5 to 10 times. And that's the real reason why, or the scientific reason I would say why we used to hear those kind of sentences. Horizontal transmission between siblings, friends, also when they're sharing foods, all of this thing can happen. This is one simple X-ray of a child about 5 or 6 years of age. It's a very healthy child. You can see all the the milk teeth, kind of being over here visible, the primary or milk teeth, and all the permanent teeth are over here in the small bubble-like structures below it. It's a very healthy case, but if you miss on any appointment with a dentist on managing your primary teeth, this is exactly what will happen. And this is not going to take like 2-3 years. This would happen in a matter of 6 months at max. All the front teeth, all your back teeth, they will be gone. There will be no more white enamel or tooth left. And imagine the amount of microbial load in such patients. It was going to impact the permanent tooth buds big time. So this is how it will look like. Many times you always brush it up, okay, it's a kid, these teeth will fall off, it's okay. But apparently it's not okay. We need to change that perception of ours. So now coming to my actual topic of oral health and preference and integration of oral health primary care. What does this basically mean? It's a very simple concept that we would like to share with you is we want to make oral health education and counseling a part of your routine primary healthcare services, just like vaccination, NCD communication, so on and so forth. And this will not be possible till the time the gravity of the oral diseases is felt by each and every one of us. The key elements of this communication is only 3. 1, we talk or promote oral hygiene. We talk about the good habits. Through that, we try to prevent these diseases. Just simple 2 diseases, cavities and gum problem, nothing else. Everything else will be taken care of easily. And lastly, we may not be able to give 100% prevention to each and every patient or a child. So patients who require dental treatment, can we ensure a good delivery, access to them to a dentist or to a dental college. Now the rationale for this integration that we would like to happen here is that earlier we mentioned about or discussed about the common risk factor approach. So if you see, the ones in the greens are the 4x4 matrix where we talk about the other NCDs, and that the blue one in the blue is the oral care diseases. All of these risk factors and the diseases associated with that, they are interlinked, they are interconnected to each other. And managing any one will have an immediate impact on the other. And out of all the diseases that you see here, I think oral diseases are the most simplest thing to manage. All you have to do is brush twice a day. That is it. Doesn't matter any toothbrush, any toothpaste, it doesn't matter, but just brush twice a day and most of these issues in the long run will kind of come under control. And of course, we have seen the bidirectional relationships between pregnancy as well as in diabetes. So, we have data show that patients who have started to brush twice a day for 3 months, their blood sugar control or the HbA1c was dropped by almost by 0.2%, by 0.2. So that's the amount of difference we can at least make by simple preventative actions. Now everything is good to hear and see and everything, but when it comes to barrier, this is a harsh reality. So this is a training needs analysis which was done in healthcare professional respondents, which included nurses, which included medical doctors, super specialties. 78% of them said that perhaps we don't have adequate training. So because I have a lot of friends in medical and I have seen their curriculum, there was just 1 page on oral health. There was a photo of the mouth, number of teeth, image of a tongue, and that was it. They had nothing to do. And during the exam, they used to come to our hostel room for like 1 hour, just see us and give us a crash course on what is number of teeth, what do you call it as molar incisor, and that's it. No one is really bothered more about it. And I believe it's not the same here as well. I don't think there's a lot of curriculum also. So we'd like to change that. We would really like to work together and see how best we can have a more training, a more adequate knowledge, a comprehensive history knowledge around it. I would say the second one is the most critical, is not a priority. Just like nurses and medical professionals, there are so many things to do, so many critical areas to look after. You have people who are on the field, they have to worry about immunization scheme, the government agendas, and state agendas, everything. Oral health is really down very much at the bottom of a priority. understand that completely, but at some point in time, at least once a week or once a month, can we take, half an hour, 1 hour effort to talk that to the community? That's all we're asking for. Can you go back? One more? Okay, next. So this is what I was talking earlier, that alone dentistry or a dentist cannot lead the entire change. We need a much larger help force. We need more hands and feet on the ground to bring about this change. And we are not asking to change the world in one day. We are going to go very strategic, very structured approach. One, we have to engage the stakeholder leadership, because without the leadership getting into alignment, without getting them interest also at the table, we are not able to move further. Once we have achieved this leadership alignment, we would like to have a more community education involvement, creating a very comprehensive training and education, stakeholdership, making them understand the basic 3 or 4 simple basic health assessment. And once done that, can they refer that to a dental clinic or OPD or wherever the accessibility is there. And finally, to a larger interdisciplinary healthcare for bigger diseases like cancer and so on and so forth. And the points that I showed is not just out of thin air. This is just I put two slides on these studies that are there. But there are ample amount of studies which shown us that this interdisciplinary approach has led to a much higher patient satisfaction, much better patient outcomes, and lesser incidence of dental cavities and dental diseases. So coming to my last couple of slides, how can Colgate contribute to this change? We have our flagship CSR event, which is called as the Bright Smile, Bright Futures. It's a completely free of cost. There is no charge for anyone who participates here. It's been running since 1991. Our target audience is the school children, because we believe they are the ones whom we can inculcate positive habits at a much higher and a faster rate. We give them all the education materials to the school, which includes pamphlets, calendars. We gamify everything around them. We also get a lot of dentists who come and participate out of free of cost. We use a lot of digital assets, because nowadays a lot of schools are shifting to digital schools. So we have a lot of content on YouTube and everything, which the schools, we give them the authority and proprietary rights to this showcase of the schools. And lastly, there is an element of dental screening as well. And once the screening is done, we give the entire data back to school. We don't keep any data with us. The school then inform the parents. They also facilitate going to a dental college, dental clinic, so that the child is beautiful. And through this, we are able to also partner with not many school, government, NGOs, and we are keeping in our true sense with the SDG goals. That is 3, 4, and 17. That is for a good health and well-being, quality education, and lastly, partnership building we are doing. And lastly, my last slide is, I believe in 2025, there is going to be some interesting conversations going to happen, and I think with the TNAI leadership team, we really look forward to build a much larger force to impact in this oral health. And on that note, I'd like to say a big thank you to each and every one of you for your kind and patient listening. Thank you. If there's anything, just let me know. I will be here for some time.
Thank you so much, Dr. Sunil. I think this was much required, because TNAI should really collaborate with Colgate, and we have bright smiles and bright future. Before we break up for tea, I would like to invite Dr. Vatsala ma'am to update regarding the concurrent sessions.
Very good morning. Ma'am, it is a time for concurrent session. The concurrent session is going to happen in the opposite building, that is the Mohali Club. So there are 7 floors in that. So each floor one specialty is going to be conducted. And the name of the presenters, the presenters are already available. I would like to call upon the presenter's name and the moderators and the staff, TNAI staff who is in charge for each hall. So first, the administration and research is going to happen in the Mohali Club, that is the opposite building in the 6th floor, that is named as Regency Hall. The presenters are Mr. Girish Kumar, Dr. Akansha Wage, Dr. Usha Malik, and Ms. R. Chandrakala. The moderators are Dr. Neeraja Sood, Dr. Smriti Kanamani, Ms. Soyafi, our TNAI staff is in charge. I call upon Ms. Soyafi.
Don't get confused with the statement opposite hall. It is same building only. All these halls are in the other block of the building in this hotel, where we have conducted the election is one hall, and all the halls are above that. We conduct the election in ground floor, and that's one hall, and all the other halls are on the same block only. Don't cross the road and go to the opposite building. It's just other side of this convention complex, the hotel and the club complex.
Thank you, sir. So totally we have received so many scientific papers, around some 106. So now today we are going to have totally 34 presenters. 34 presenters are there. So Ms. Soyafi is in charge for the administration and research, and Ms. Soyafi will be accompanying the moderators as well as one of the vice president will also be available in the hall.
Vice President, then we can take it.
For the administration and research, Madam Swapna Joshi will be there. And in the same 6th floor, the second hall is the regal hall. There, presentation of community health nursing will take place. Ms. Akash Preet Kaur, Ms. Narayani Sahu, Ms. Gurjit Kaur, Mr. Vikas Bhaskar, Dr. B. Indumadi, Ms. Shalini Joshi. So these are the presenters, and the moderators are Dr. Rajeshwari Pudi, Mrs. Shilpa Ashok Shetigar, Dr. B. Mr. Apu is in charge of this community health nursing regal hall. It is in 6th floor. You can use lift to reach any of the floors. Mr. Apu will take charge, and he will accompany the moderators as well as our vice presidents. Dr. Jane Kem, she is in charge of the community health nursing presentations. Thank you. Next, the medical surgical nursing. This is going to happen in the town hall, which is in 5th floor. The presenters are Ms. Navdeep Dinga, J.V. Jivita, Ms. Manimengale, Dr. Radhika, Mr. Bishan, Mrs. Cynthia Sebastian, Mrs. Shani S.D., Mr. Shashi Kumar Javadagi, Ms. Shivani. The staff in charge is Dr. Vijayalakshmi from TNAI. The moderators are Dr. Harmeet Kaur and Professor Venu Susan, Dr. Monika Datta. The vice president in charge is Madam Tara. Madam Tara? Okay. So the nursing education, this is going to happen in the urban hall, which is the ground floor where the election had taken place. And the presenters are Professor Ragnar Dinamani, Dr. Asha Raj, Mrs. D. Geeta, Dr. Anil Sharma, Dr. Ruth Joshila Phillips. And the moderators are Professor Dr. Samshir Beham, Dr. Rajesh Kumar Sharma, Dr. Manju Dandapani. Ms. Anu Verma, she is the in charge for this hall, the urban hall, and Madam Anita Diodar, our former president of TNAI, will be also available in the hall. Thank you. The next specialty is OBG and child health nursing. This is going to have any presenters of this, the OBG and child health nursing. This is going to happen in the same hall. Please make a note, presenters are there. This is going to happen in the same building, that is Terrace Garden, the 2nd floor. Yes, Terrace Garden, 2nd floor in the same building. Only this OBG and child health nursing is going to happen in the same building. For this, I call upon Ms. Pallavi. She is in charge of this hall, and the moderators are Dr. D. Kavita, Ms. Vani Aisha Akhtar, Ms. Rupinder. And the vice president and the madam who is in charge is Mrs. Lucy Simon. Please take them. So this is only OBG and child nursing in the Terrace Garden, 2nd floor. Right. The last thing is mental health nursing. This is going to happen in the card pool, the 7th floor in the Mohali Club. It is the topmost floor, 7th floor, and staff in charge is Mr. Jijo. I call upon Mr. Jijo, and the moderators are Mrs. Bindu Shaiju, Dr. Kalyani Moharana, Ms. Renu. So they will accompany the moderators, and Dr. Ramindra Kalra, she will be available in this hall of mental health nursing. Thank you so much. I think our TNA staff can accompany the moderators as well as the vice presidents and the faculties in charge of each specialty. Now, I humbly request all the presenters to refresh yourself and come to the concerned hall. Thank you. After the concurrent session, all of us can have lunch followed with valedictory function. Thank you.
Kind attention to all the delegates present over here. We found one TNAI membership card, Miss Kirthana MV from Tamil Nadu. Miss Kirthana MV from Tamil Nadu. Anybody from Tamil Nadu, they can come and collect from the console. So it is with us. If anybody lost their TNAI membership card, it is with us in the console. Kindly just inform whoever from Tamil Nadu, they can come and collect. Miss Kirthana MV.
we are proud to introduce the TNAI's National Advanced Nursing Simulation Center, a premier facility now open at Greater Noida. With this launch, TNAI
लाइटिंग जलाएगा ना भी फंक्शन, देखो कोई ज़्यादा नहीं करना जी कलर कर देना, अभी लाइटिंग जलेगी जब वो बोलेगा फिर कैमरा आगे लेके जाऊँगा ना तो मैं दोस्त कैमरे की बैटरी खानी है ना और कुछ नहीं करना।
ठीक है नहीं
ये वाला कैमरा इस पर लगा दूँ ना, ये स्टैंड मैं ले लूँगा, स्टैंड इससे होएगा ना, ये स्टैंड है ना। हाँ वो वही रहना, वो बता दूँगा।
जितनी
International TNAI Conference 2024. We are pleased that our chief guest is amongst us and we are going to start our function. To start with, I invite the students of Train Nurses Association, Chandigarh UT branch for a welcome song.
Ah
Thank you, dear students. These are the students of National Institute of Nursing Education, PTI, NER, Chandigarh, the local branch of Chandigarh. Thank you so much. Moving on to next. Lamp lighting is a significant and traditional ceremony. I would request all the dignitaries for the lamp lighting.
कैमरे में क्या होगा?
तेरी उस पे तो नहीं है ना, इसका है ना लाइट पे
मेरा है।
तेरा कहाँ है? इसका वो दे स्क्रीन पे।
जाना मेरे को
कहाँ है? इसका जो है डिस्प्ले में डिस्प्ले लाइट तेरा जो है।
Thank you. I would request Professor Roy King George, National President TNAI, to present a floral welcome to our chief guest, Sri Ajay. I also request Dr. Sukhpal Kaur, the President of TNAI Chandigarh branch, to honor Dr. Roy King George. Thank you, ma'am. Thank you, sir. May I request Dr. Sirfan Kaur, the President TNAI branch, to deliver the welcome address.
Thank you. Respected Mr. Ajay Shakti, Secretary Head, Chandigarh, distinguished guests, esteemed delegates, colleagues, and my dear friends. A very good afternoon to one and all. It's my privilege to extend a warm and heartfelt welcome to all of you as we gather here for the valedictory function of the 78th National TNAI Conference. After days of engaging sessions, thought-provoking discussions, and enlightening interactions, we have reached the culmination of what has truly been an enriching journey of knowledge sharing and collaboration. I am particularly honored to welcome our esteemed chief guest, Shri Ajay Shakti ji, whose presence today elevates the significance of this occasion. Mr. Ajay Shakti ji is Secretary Head, Chandigarh. Sir is a distinguished officer of Indian Administrative Service from AG/MUT cadre. His illustrious career and dedication to public service are truly inspiring. Mr. Shakti's journey began at the military school Jail, where he laid the foundation for a disciplined and goal-oriented life. He furthered his education at Punjab University, Chandigarh, earning a degree in chemical engineering and an MBA, equipping himself with the technical and managerial skills which are essential for governance in today's world. Currently, Sir holds multiple crucial assignments in Chandigarh, demonstrating his versatility and leadership. As Secretary, Health, Medical Education and Research, he oversees public health initiatives and the advancement of medical education. In his role as Secretary Personnel, Sir manages personal policies and human resource development for the administration. As Secretary Excise and Taxation, he spearheads reforms in taxation, ensuring efficient revenue collection. He also serves as Secretary of the House Allotment Committee, facilitating equitable housing allocations. As CEO of Chandigarh Housing Board, Sir leads urban development projects and housing initiatives. Furthermore, he is the appellate authority for GST, handling appeals and insurance compliance with tax regulations. Before his tenure in Chandigarh, Sir served in Arunachal Pradesh from 2020 to 2023, where he held pivotal roles including Secretary of Science and Technology and Secretary, Personal and Administrative Reforms, driving modernization and innovation. His earlier services in Delhi, spanning from 1993 to 2002, 2005 to 2020, Sir himself took up a number of assignments in departments like Home Affairs, IT, Transport and Personnel. During this time, he was instrumental in implementing large-scale e-governance reforms, enhancing public service delivery and digital transformation. Mr. Shakti was honored with National E-Governance Award in the year 2014 for his pioneering work in digital governance. A significant highlight of his career was in the year 2004 when he worked in the Andaman and Nicobar as Additional District Magistrate and CEO, Jilla Parishad. During the aftermath of the devastating tsunami, he led relief and rehabilitation efforts, showcasing exceptional leadership and compassion in times of crisis. With his expertise in public administration, policy formulation, e-governance, and disaster management, Sir continues to be a role model for aspiring civil servants and a pillar of effective governance. Thank you very much, sir, for spending your valuable time and being with us on the valedictory function of this very, very important conference. I also take this opportunity to express my deep gratitude to Professor Roy K. George, who is the President, National TNAI, and Dr. Evelyn P. Cannon, Secretary General of TNAI. They are basically the backbone behind this great event. And sir, thank you very much for holding our hands. This is the first time we have taken this initiative, a small branch, but we have tried our level best to give you the best. Thank you very much for guiding us all throughout the planning of this conference. I also welcome all the eminent speakers, panelists, and participants who have traveled from far and wide to be with us during this conference. Your active engagement and dedication have been the driving force behind the success of this conference. So as we move forward, this valedictory session serves as a moment to reflect on our achievement, share our take-home messages, and envision how we can transform the knowledge which we have gained here into impactful action. So once again, with folded hand, I welcome each one of you on the concluding session of this 78th National TNAI Conference. Thank you very much.
Thank you, Suparman. It's time for the conference resume. I invite Dr. Natasha Sharma to give the briefs about the conference.
Thank you, ma'am. Good afternoon, ladies and gentlemen. I feel honored to give the conference resume. So the 78th National Conference of the Trained Nurses Association of India, hosted by the TNAI Chandigarh UT branch, was held on December 6th and 7th, 2024 in Chandigarh with the theme Leadership in Nursing, Inspiring Vision, Driving Change. The conference witnessed the participation of around 2,000 nurses from across the country, making it a landmark event for the nursing fraternity. While the preparations for this conference began long back, but the formal first meeting, the pre-conference meeting, was held on 3rd December at National Institute of Nursing Education, PGIMER Chandigarh, and this meeting focused upon the finalization of the conference arrangements and the review of the other organizational strategies. The executive committee meeting was held on 4th December. This meeting provided a platform to discuss the organizational achievements, challenges, and the strategic directions for the upcoming year. On the same day, there was a grand press conference which was held that garnered extensive media coverage, drawing attention to discuss critical issues such as the low wages in nurses with a lot of pay disparities, especially in the private sector, the limited promotion opportunities with lack of structured pathways for career advancement for nurses, and the very much growing concern of some unregistered individuals who misrepresent themselves as nurses, as trained nurses in the society. Thereafter, the formal inauguration of the conference was held on 6th December with a grand parade that featured representatives from all TNAI state branches who were dressed in their traditional attires. This vibrant display of India's unity in diversity symbolized the strength and solidarity of the nursing community nationwide. On this event, Dr. Deepika Kaka, nursing advisor at Ministry of Health and Family Welfare, unfolded the theme of the conference. She emphasized the pivotal role of leadership in nursing and the importance of nurses as being problem solvers in shaping the future of healthcare. On the same occasion, Dr. Dilip Kumar, who is the President INC, he was the guest of the honor for our inaugural event. He highlighted the crucial role of Indian Nursing Council in shaping the nursing education, and he highlighted upon the competency-based curriculum to enhance the skills and expertise of our future nurses. The chief guest for the event, Dr. Balbir Singh, the Honorable Health Minister, also highlighted the indispensable role that the nurses play as the backbone of healthcare. During our inaugural session, the Secretary General TNAI, Mrs. Evelyn P. Tannen, she honored the National President with a presidential chain, and Dr. Bimla Kapoor was honored with a prestigious Lifetime Achievement Award in recognition of her exceptional contribution to the nursing profession. We also had the souvenir release during the inaugural ceremony. The inauguration of the scientific poster exhibition took place on the same day, wherein there were a total of 28 posters which were showcased, and it was all insightful posters that highlighted knowledge sharing and fostered academic collaborations. During this conference, Mrs. Vachla Dhinkaran, Assistant Secretary, SNAI, she also discussed the role of Student Nurses Association of India and its journey towards reaching the milestone of its centenary celebration in 2029. Mrs. Sangha Mitra Sawant, Deputy Secretary General of TNAI, highlighted the significant contribution of TNAI's Central Institute of Nursing and Research Center in Greater Noida focusing upon its role in advancing professional development through education and various training programs. During this ceremony, Captain Sandhya Shankar, who is the Group Chief of Nursing at Fortis Healthcare Limited, she delivered a compelling session on the transformative role of leadership in nursing. She highlighted the essential qualities of effective leaders, including vision, resilience, and empathy, and she further emphasized the importance of fostering a supportive, collaborative environment within the nursing community. A grand cultural evening on December 6th added a vibrant touch to the conference. The evening featured captivating performances that highlighted the cultural heritage of various states. This event provided a perfect blend of tradition, entertainment, and celebration, offering a memorable experience to all the delegates. The second day of the conference featured plenary sessions including discussions on integrating oral health into primary care and skill building through simulation-based training. On the second day, there were concurrent sessions in the conference halls on oral paper presentations which showcased innovative research and some of the best practices in nursing. So at the end, I will conclude by saying that this event, which was a rich mix of tradition, innovation and collaboration, it reaffirmed the crucial role of nurses in transforming healthcare in India. Thank you one and all.
Thank you, Dr. Natasha. Now I would like to request Dr. Joy K. George to come and give the valedictory address.
A very, very warm good afternoon to all who are assembled here, the dignitaries, my dear friends and colleagues in the great profession of nursing, especially the TNAI members. The 78th Annual Conference of Trained Nurses Association, 78th National Conference of the Trained Nurses Association of India is concluding today evening. A conference which was conducted or hosted by the TNAI Chandigarh branch in Mohali. And I am very pleased to deliver the valedictory address, probably my last address as the TNAI National President of our great association. Respected Chief Guest, Sri Sakti, IAS, my colleagues in TNAI National Office, former Vice President, former National President, Dr. Anja Deodar, Secretary General, Mrs. Evelyn Kannan, current National Vice Presidents, Mrs. C.S. Tata, Mrs. Sapna Joshi, Mrs. Ani Kumar, Dr. Jeni Kam, TNAI Chandigarh UT Branch President and Secretary, and the newly elected team of TNAI National Office headed by Mrs. Ani Kumar, all the Vice Presidents and the Treasurer. Really, I feel very gratified, happy that we could conduct this conference successfully with the support of each and everyone. A big round of applause goes to each one of you. It is your conference, we have done it successfully. In the last 6 years of TNAI, with the support of each and every member of TNAI in this country and abroad, with great leadership skills of my wonderful team, we could together pass many milestones. But to especially to the young members, my colleagues, and the Student Nurses Association office bearers, I tell you, I pledge you that we have done very little. You have to do a lot of things in the future. Miles to go before you sleep. The moment we feel that we have done everything, we are fools. There is no limit for improvement and perfection. We can always improve upon. Whatever we have done in the last 6 years, usually the TNAI national leadership gets 4 years term. Unfortunately, we got 6 years term because of the very severe pandemic of COVID. I don't think it is a credit. It was a crisis which world faced with a lot of stress and anxiety. The only crisis, the only true pandemic most of the health professionals who are alive today have witnessed. But it was a great learning experience for all of us. Not only for you, not only for me, for the world itself. So TNAI also has learned a lot of things, and in that new learning, we could make some achievements. Actually, with the support of TNAI members, especially the state presidents and secretaries and ordinary life members that who are the bloodline of TNAI, we could see wonders, we could learn many things and resulted in unforgettable achievements. The credit goes to each one of you. I was lucky enough to be national president during that day. That is only my credit. It is not because of anyone's ability that it happened. It is destiny. A destiny of a nurse, a destiny of a Kerala nurse who decided to stay in India to see whether we could do something to promote the profession. There has been setbacks. There has been people who tried to disturb it in the last HOR meeting, but the destiny leads us further by saying that nobody can endanger, threaten or capture this great association. We have proved it. The credit goes to you. People may come and go, and the other has come and gone. I am going on this day after completing my term as president. Thankfully, I could complete with satisfaction because I could do certain things or I could lead certain things. It is not me who did it, as I told earlier. I was lucky to be part of it. So when Mrs. Anitma comes and new team comes, I will be one of the most happiest person if they could do better things, make association stronger, wider, healthier and stronger by contributing to the development of nursing in this country. And after all, most importantly, take care of people of this country. If we could retain more nurses in this country by improving their working conditions, their salaries, their recognition, their status, that is the greatest achievement TNAI can do. At this present, in the last 6 years, we have been facilitating nurses who are desirous of going to abroad. A golden day will come for TNAI when TNAI will be able to say nurses, don't leave this country because no other country can offer this much to you. It may be after 50 years or 100 years, but the credit will go to each and every TNAI member and the leaders who built this association. So I take it as a challenge, and I offer it as a challenge for the future leaders and future nurses to build upon what the former leaders have done and to improve upon the status of the profession, your work, because their effort, there may have been many faults, many missing points in the work of teams till this point, that is the team led by me as national president. For it is for the next generation of next leaders to improve upon and learn from experience. As I mentioned, COVID gave us a lot of learning experiences, how to manage a critical situation. We were also stunned what to do. And give more opportunity, we had to work much more. And it gave one of the invaluable prizes of the India International Peace Prize in the name of Srimati Indira Gandhi, which was shared by TNAI and IMA. It was the only platform, though we say TNAI is like IMA for doctors, that was the only forum in which TNAI and IMA was equally honored by one of the reputable trusts in the national capital. And that's what it goes to us. So we have to try this way and make challenges into opportunities to grow. Whether it is COVID market tower in the Noida, or National Nursing Museum in Noida, or renovation of TNAI building in Delhi, it's all because the contribution and membership of this association. One of this, I still remember the first moment I attended a TNAI conference decades back, national conference. It was a low-key affair. As a young nurse, I have dreamt when we will have a conference which everyone would love to come when the TNA goes. At least I could see it in my lifetime or during my office bearship because of participation of TNA members, leadership abilities of each and every one of the executive team, and the support of hosting branches and everyone who made it a point to come to Chandigarh. So that's the way we have to ask Dr. APJ Abdul Kalam told. The dreams that you have during sleep is not important. The dreams that you will feel, which will make you sleepless is important. I have not done, it just never made me sleepless, but at least it was a dream, it was just an expectation, because I have attended many other national and international conferences, other associations, especially medical professionals and corporate programs, where we thought, when we will have such a thing. I am very happy to be here with all of you, celebrating the success of this conference. So thank you very much, everyone, for making this conference very successful. And request you to continue this. Let this success of this conference be a motivation and a hitting point or inspiring point for you to participate more actively in the professional association, in the development of association and development of profession of nursing. Contribute each one's little bit to this great profession of nursing by making it a very distinguished, recognizable profession in our country, our mother country, India. I take this opportunity to thank all my excellent team in TNAI National Office, our office support staff who have spent sleepless nights to make this conference successful, and the hosting team which cooperated up with wholeheartedly to make this conference a grand success. Special thanks to our Health Secretary of Union Territory of Chandigarh, who is a person who is holding 7 portfolios and who works almost 7 days, but he told we will be with us for the next 1.5 hours from 3 or 4. It's a great gesture, sir. We are honored by your presence here in this small Union Territory, and we are happy that you are spending time with us. Thank you very much, sir. Once again, thank you. Great years of TNAI are yet to come. Please go ahead. Thank you.
Thank you so much, sir. We are very fortunate to have a leader like Dr. George who can shake the dials also. We are very happy, sir. Your leadership and your motivation is really what is required. Now, with honor, I would request our chief guest, Sri Ajay, the Secretary Health, to address the gathering.
जोश कैसा है? प्रोफेसर डॉक्टर Y.K. जॉर्ज, नेशनल प्रेसिडेंट TNAI, मिसेज इवलिन E. Kannan, सेक्रेटरी जनरल TNAI. We have vice presidents here of various regions of TNAI, and Mrs. Annie Kumar, who will be now the president after some time, President and Secretary of Chandigarh UT branch. In fact, I have never met Tukpal Kaur Madam. This is the first time, and even though we got some emails, we hope to meet more often and take it forward. And of course, most important, distinguished delegates who have decided not to go to Wagah border or Amritsar and who decided to sit here. So good afternoon. It is indeed my proud privilege to address you today at the 78th National Conference of Trained Nurses Association of India. As we gather here in this remarkable assembly, we are reminded of the significant role that nurses play in the healthcare systems of our nation. The pioneering work of Florence Nightingale, who is widely regarded as the founder of modern nursing, who transformed nursing into a professional scientific discipline, and our sisters have not left the country behind in making efforts which are nowhere less than Florence Nightingale. Congratulations to everyone. Nursing, as you all know, is not just a profession, but a calling. Nurses are the heart and soul of healthcare, providing essential services with dedication, compassion, and expertise. The role of the nurse goes beyond just the clinical part. Beyond the clinical part, you are the caregivers, the educators, the leaders, and advocates for public health. Yours is the most noble profession in the country. The caring, sharing that you do, that is the noble part. Even doctors don't do as sorry to say, the doctor sitting on the dais. It is the nursing cadre which does it, the caring part. The theme of the conference resonates deeply with the current healthcare needs of the country. And we applaud the Trained Nursing Association of India for its steadfast commitment to the professional development and welfare of nurses across India. Over the years, TNAI has been a vital force in shaping nursing education, standards and practice, helping nurses to remain at the forefront of the healthcare delivery system. The theme, Leadership in Nursing, Inspiring Vision, Driving Change, emphasizes the transformative role that nurses play in shaping the future of healthcare. Leadership in nursing goes beyond managerial responsibilities. It embodies the ability to inspire, motivate, and drive meaningful change within the healthcare system. Nurses, with their direct innovation, improve patient outcomes and lead by example in fostering compassion, evidence-based practice. The best example was during COVID days, when people would not touch their relatives, would not come near their relatives, but the nurses bore the brunt of all the healthcare delivery burden. So, special thanks to the profession. As leaders, nurses possess the vision to recognize emerging challenges and opportunities in healthcare, and the determination to implement solutions that ensure better quality care. This theme highlights the importance of nurturing leadership at all levels of nursing and empowering the professionals to shape a healthcare environment that is more responsive, efficient and patient-centered. By cultivating strong nursing leadership, we are building a future where nurses not only provide care but also drive systemic improvements that impact the health and well-being of communities. The Government of India recognizes the invaluable contribution of nurses in the healthcare sector. The government is continuously striving to improve the working conditions, professional development opportunities, and the recognition of nurses, understanding that a well-supported nursing profession workforce translates into better healthcare outcomes. The government's focus on strengthening healthcare infrastructure includes enhancing nursing education, promoting advanced training, and ensure that the nurses have the resources they need to provide the best possible care. While performing my assignment in Arunachal Pradesh, While performing my assignment in Arunachal Pradesh, I have been lucky to participate in the human resource strengthening process of the nursing cadre. I learned a lot about healthcare with the leaders of nursing cadre in Arunachal. Our Deputy Director, Kijung Karga, our colleague Techi Mepung, who is also the General Secretary of TNAI in Arunachal Pradesh, they were very sure that they can at gunpoint get their things done. I congratulate the Arunachalis for upgrading the systems in Arunachal, and this has helped me a lot. It is the first tenure, my first tenure as Health Secretary, and it was a good internship experience in Arunachal that I am performing the role of Secretary of Health now. Earlier I have never done it. Today, as we reflect on the program that has been made, the progress that has been made, we must also look forward towards the future. The healthcare landscape is rapidly changing. How do we respond to it? The role of nurse is evolving fast. To meet these demands, we must ensure that the nurses are equipped with the knowledge, tools, and skills to thrive in this increasingly complex world which is technology-driven. The government is committed to supporting initiatives that provide nurses with continuous learning opportunities and access to modern healthcare practices. If you have any problems in your state, you can come to Chandigarh. In conclusion, I would like to express my heartfelt gratitude to all the nurses who tirelessly serve the nation every day, and the team led by Professor George, who is busy. Your work, often behind the scenes, saves lives and improves the well-being of countless individuals. I reaffirm our commitment to work alongside the TNAI. इसको मैं तन्हाई नहीं बोल रहा हूँ, तन्हाई बोल रहा हूँ. And all healthcare professionals to ensure that nursing in India remains a strong, respected, and essential pillar of our healthcare system. I wish that the proceedings of this event, in fact, awe-inspiring conference, filled with insightful discussions, knowledge sharing, and the forging of new collaborations, are shared with all, including me. I will like tonight, I am sure, will continue to elevate the nursing profession in India. Best wishes for the future. Thank you. Jai Hind.
थैंक यू सो मच सर। अक्सर हमें टाइम नहीं मिलता अपने हेल्थ सेक्रेटरी सर से मिलने का, तो दिस इज वन ऑफ द वेरी गुड अपॉर्चुनिटीज when we have sir here and sir has addressed. And the most important thing is sir looks after human resources also. Sir, human resources is also always less than nurses, although they take 80% burden of the health care. So sir, Tanya for yes, it's for taking 80% burden, but human resources also sir. Thank you. Now I would request Dr. Sukhpal Kaur, the President of Chandigarh UT branch, to honor our chief guest. So, we are honored to release the books which are written by TNAI. For the first book, I would like to request Mrs. Anu Verma, who is going to brief us about the book and the publication of the book.
Good afternoon to all the respected National Executive and Council members, distinguished guests, conference delegates and participants. I, Mrs. Anu Verma, Project Manager, TNAI Headquarters, would like to introduce about Nursing Administration and Management Book. As per the National EC members' decisions, November 2009, they decided to revise the Book of Nursing Administration Management Book. The book was written by the following authors: Dr. A.T. Kora, former Nursing Superintendent, St. Stephen Hospital, New Delhi; Mrs. Sudekha Sawant, former President, Maharashtra Branch; Dr. Jaya Rani, Principal, Provost College of Nursing; Dr. Jyoti Clara, Director, Global Hospitals, Chennai; Dr. Annie Kumar, Vice President, North Region, TNAI; and Dr. Selva Titus, former Principal and the Content Editor. I humbly request our chief guest and all the dignitaries on the dais to release the book.
kindly request the dignitaries to be for a minute. The another achievement of book release project of TNAI is the release of History of Nursing book today, which was initially taken up by Maharashtra TNAI State Branch in 2019. The chapters were authored by the esteemed leaders of TNAI Maharashtra State Branch, Mrs. Sureka Samant, the former president, Mrs. Prachidara, the former secretary, Mrs. Swapna Joshi, the national vice president West Region, Dr. Rita Lakani, Dr. Avani Go, Mrs. Shobha Gaekwad. The content of the book was edited by Dr. Challaran Vijay Kumar, the dean of the former CMC College, Christian Medical College of Nursing, and also by Professor Dr. Rajeshwari Shiva, HOD of the Community Health Nursing Department from CMC College of Nursing. I respectfully invite the chief guest of the day and the dignitaries on the dais to release this book during this esteemed gathering.
Congratulations to TNAI once again. Let's clap. TNAI. And it's a very good platform where we can all participate and be editors and write books, authors and editors for the books. Thank you so much, TNAI, for that. For the proceedings, next proceedings, I would like to invite on stage is Madam Sangamitra.
So the most awaited time of the conference is here. Today we have the privilege to recognizing our stars, those who shine bright and inspire us to strive for excellence. Each award present today symbolizes a story of resilience, compassion and relentless pursuit of knowledge and care without delay. Let us begin the award distribution ceremony without delay. So first of all, I am giving the poster for awards for the posters. Scientific poster exhibition we received total 33 posters. Out of 33, 28 were selected and displayed for the poster exhibition, and it was evaluated by 5 experts. So first, we would like to give the third prize for the scientific poster competition, that is code number 11011, that is Ms. Supreet Kaur, SKSS College of Nursing, Ludhiana. So please give a big round of applause for the third prize winner, Ms. Supreet Kaur, SKSS College of Nursing, Ludhiana. So Madam Prajjot is receiving the award. I request all the dignitaries to please be here till the end of the prize distribution. The second prize winner for the poster exhibition is code number 003, that is Miss Sanjana from SKSS College of Nursing, Ludhiana. There is a tie between the second prize winner, 020 and 003. There are two second prize. So I also request Ms. Sukhjeet Kaur from National Institute of Nursing Education, PGI Chandigarh, to receive the award. For some problem, we are just withholding the poster prize. Now we are going to give the mementos for the judges of the poster. So the judges, I would like to invite to stage to receive the mementos. Dr. Daisy Thomas. On behalf of Dr. Daisy Thomas, if there is anybody from Chhattisgarh, they can come and receive the award. The memento for Dr. Daisy Thomas, is there anybody? Yeah, please. Next evaluator, Dr. Sunil Kumar. I would like to invite Dr. Sunil Kumar on the stage. Dr. Prabjot Saini, Dr. Sunita Lawrence, and Dr. Sunita Sharma. These are the 5 evaluators of posters. Kindly come on the stage. Please give a big round of applause for all the judges who evaluated all these exhaustive posters. Now I would like to invite Mrs. Vachala Dinakaran to further give away the awards.
The biennial state grants reported for the period of November 2022 to October 2024 was submitted by 10 states and UT branches. Based on the evaluation criteria, the state activities like conduction of state conferences, special programs, education programs, grievances handling, and data membership enrollment. The award for the maximum educational programs conducted is awarded to Maharashtra TNAI State Branch. I humbly request the former secretary, Mrs. Rajidhara, Mrs. Sureka Sarand in absence here, Madam Joshna Pandit, Madam Anita Diodar, to come forward to to receive the award.
Jai Shivaji. Yes, sir. This go down, sir. Okay. Yeah, this side, please. Okay, sir.
Now we are announcing the highest membership enrollment awards for the last 2 years. So the third prize for the highest membership enrollment goes to Maharashtra State Branch. I request the former secretary and vice president and other members, including the current president, Mr. Rajabhav Raju, and other members of the new state branch to come forward and receive the third prize for highest membership enrollment. Maharashtra enrolled 2,244 memberships in the last 2 years. For this, they are receiving the third highest membership enrollment award by a state or UT branch. Congratulations to Maharashtra State Branch.
That is right, sir. Okay.
The second prize for the highest membership award goes to Kerala State Branch for enrolling 3,389 members in the last 2 years. We welcome the Kerala State Branch President, Secretary and other officials to come forward and receive the award for highest civil membership enrollment award. They have enrolled 3,389 TNA members in the last 2 years. Congratulations to Kerala State Branch for their achievement for highest membership enrollment in the second position. And now the first prize goes to Tamil Nadu State Branch for their 6,051 memberships in the last 2 years. I request the Tamil Nadu State Branch executives, led by Vice President Dr. T. Uday Kumar and other members, to receive the highest membership enrollment award. In the last 2 years, I repeat, in the last 2 years, they have enrolled 6,051 members into the TNAI sword.
Yes, sir. In fact, please, sir. Okay, sir.
Thank you. Congratulations to all the winners, and we request the same from all the state branches for their continuous efforts to increase the membership. Thank you.
significant performance award. Because I just want to say that because we used to write a letter 6 months before to every branch to send your branch report. We received we have 34 branches and we have received only 9 report from the 9 branches. Out of the 9 branches we evaluated, we have sent the format and criteria and everything. In that one branch we see the significant award because they have addressed the grievances. They had a lot of impact, some of the things. So this award we are going to give it to West Bengal State Branch. Because they addressed some of the issues and they resolved some of the issues. So this award will go to the West Bengal State Branch. Because this award is as per the criteria and because many of the branches send award, they send the information about the student nurses benefit also. The student nurses activities and all will come under the SNA report. Please alert next year when they send the report, talk about only the activities of the student nurses. This is the major activities you are performing for the trained TNAI conference. Every year we give a award according to the conferences, so you have to. Now one more award, because outstanding TNAI branch. This outstanding TNAI branch award goes to Kerala State Branch. Because for evaluating the report, they met all the criteria, they given the supporting documents, whatever the press, every evidences are there in that award. These are the major awards received every time: membership enrollment, award for the excellence organization, maximum dedication, outstanding award, and significant performance of award. Next time, every branch have to aim to get this all the award.
Okay, sir, this side, please.
Thank you so much, sir. I think this can be seated. And because just only Ms. Adna said that Tamil Nadu got 6,551 and Kerala branch 33. And next time I would like to add more because at least 60,000 members will come for every year. Because we want that every year, because we have a 5 lakhs member, every 5 lakhs having one member next year, we are coming for that and one more at least 2 years. And we want the Tamil Nadu branch get the double and triple and quarter, at least bring 1 lakhs member from Tamil Nadu branch. This is a target for you. And Kerala branch you can bring again more than 50,000. Please make it a target. And Maharashtra branch you can bring more than. So these are the plans and let us see who is going to first prize next year. So please take this as a challenge because membership is only one-time membership, lifetime membership. Because only max of 2,000 first year and 2,200 as soon as they become, they want to, they not become a member, they want to become a 3,000. Out of the 3,000 only lifetime membership. Please explain all these benefits to them, make them remember. Next year we have more award, more benefits for the entire nurses in India. Because as we are number 1 in the world, we have to have at least next year. We have to come and say that we have a 5 lakhs, not only 5 lakhs, we have a 10 lakhs more members of our association. 100% membership in this India is very much needed. I hope each one of you take the news forward and we will make this as a great success. We will celebrate it together next time in the TNAI conference in 2026. Are you all motivated to have more membership? Yes? Sponsors
will try and have 100% registration of TNAI. Right. Now coming on to the very important ceremony of the valedictory function.
In between our mistake, one more award and extremely fun. Extremely fun. The poster third prize goes to Dr. Aman Kalia. We'll give a big round of applause for Madam. Thank you so much, sir, Madam.
फर्स्ट प्राइज देंगे भाई अब देंगे तो मतलब उसका यहाँ लग मेरे पीछे अरे मेरे पीछे एकदम इधर पीछे का थोड़ा साइड से पीछे का पीछे बहुत ठीक है नहीं बहुत है
Second and first.
The second prize for the scientific poster evaluation is Ms. Sanjana from SKSS College of Nursing, Ludhiana. So first prize for the scientific poster evaluation is Dr. Geetanjali Kalyan from National Institute of Nursing Education, PGI Chennai. I request all the dignitaries to please come forward to give away the awards.
Yes, sir, it's set, please. Okay.
We are excited to have the handing over ceremony of the national officers. So before moving on to, I just would like to brief about the last election happened in 2018. The last TNAI national election was happened in December 2018 at Goa during the Pioneer Conference. And the national officers were the election here, Dr. Roy K. George as the National President, Mrs. Ani Kumar, Vice President North Region, Mrs. C.S. Tara, Vice President for the Northeast Region, Mrs. Reena Bose, Vice President for the East Region, Mrs. Swapna Joshi, Vice President for the West Region, Dr. Jenny Kim, Vice President for the South, Mrs. Shanti Latra, Honorary Secretary for AMM, and Dr. Srinivasan Gandhi, Honorary Secretary for LHP. Due to COVID pandemic, the election could not be conducted in the due period that's in 2022, so hence the National Council decided to have an extension of 2 years, similar to the extension given to the state branches. And the due was 2024, and the election held in December 5, Mohali, Punjab. I request Dr. Ravinder Kaltra, National Returning Officer, Mrs. Lucy Patrick Simon, and Mrs. Bindu Shaiju, National Election Committee, to come forward and to brief about the election held on December 5, 2024. Over to you, madam.
Thank you so much. I know the elections have been very exciting, but thankful to all the voters, extras, and all other contestant EC members that it went on very peacefully. Thank you so much for all your cooperation. To start with, there were total 823 House of Official Representatives, that is H1, which were nominated from the various state branches. Total votes polled were 781. The contestant who won the national office position, I'm proud to say that to announce the name, which is already announced, but to officially that they will be taking over today, Mrs. Ani Kumar as National President. Mrs. Jyoti Valia, Vice President North. Mrs. Thodan Nandalani Devi, Vice President Northeast. Dr. Abhilekha Riswal, Vice President East. Mr. Deep Kamal Vyas, Vice President West. Dr. Bhaji Kali, Vice President South. And Mrs. Shiny Thakur, National Treasurer. The post of National Secretary ANL LHP is vacant due to non-receipt of eligible nominees. The winners will be resuming their office after 30 days of the election result, that is 5th January 2025. Now I will request Mrs. Evelyn, Secretary General TNAI, to take over for the further proceeding. Thank you so much. This is a very precious and very emotional and important moment for the entire nurses in India. And in 2018, also we had the same feeling. Now we have a very mixed feeling because we work with them with all dedication, the way they have taken a decision, and we as a headquarters, we have implemented what all the decisions they have taken. So it's an honor and privilege to work with the entire team of the existing, and it's not only 4 years, we all get a 3 years extension, we all elected to work with you. We will be able to achieve all the things, whatever you have decided in the last 6 years. And on behalf of the entire nurses in India, Professional Association, as well as the entire headquarters staff, we salute you for all the efforts which you have done. It is really amazing. It was really amazing to work with you, sir, as well as all madam. We have a core committee meeting because we had many meetings and we had really enjoyed together. I would like to request Mrs. Sandhi Lata also to come and sit here. Yeah. So anyway, we have a long way to go. We have done, and as he said in your addressing, we have many more to come, and we all will work together to achieve many. And as Secretary General of the Trained Nurses Association of India, this is also a great responsibility, the pride and honor. I humbly request our National President TNAI, Professor Dr. R.K. George, to hand over the presidential chain to the elected President
President Madam Annie Kumar.
Yes, ma'am. सामने प्लीज एक
Thank you so much, sir.
Yes,
Thank you so much, ma'am. And I want Madam Annie Kumar to stand behind where Dr. Ajay was sitting. Yeah? Yes.
The moment I
So immediately, because even though it's officially declared December 5th is elected president, as per the bylaws, you have to wait for 20 more days to come. So once the 20 days are over, we officially invite all the elected as well as the existing president group to come over there and we officially hand over all the things. Sir, what are the achievements you have taken, you have done for last 6 years, everything is entered in this book. I kindly request you to hand over this report to Madam Annie Kumar so that she will bring double amount of book next year, sir. Next This is a presidential, the outgoing president will receive the pin. Now I kindly request Madam Anita Bella, our past president of the Train Nurses Association of India, to hand over the presidential pin, outgoing president, for our president TNAI, President TNAI, Professor Dr. A. George.
उधर ना जाना पड़ता भाई ना छोड़ देना उसको Okay, sir. Thank you.
Now I request our North Vice President, Madam Annie Kumar, to hand over to Dr. Mrs. Jyoti Walia, Director. Please. Yes, sir. Please, sir. And this is a reporting. Yeah. As we are not, unfortunately, we lost our least vice president. I kindly request Dr. Apileka Prasma now. He's not there.
The East for Indian President remains right of the Vice President of the TNAI of the East region. So I am taking that responsibility. Otherwise, here those people who do not know her. So this is on behalf of the East Vice President and handing over of the Hall Show.
Now I request Mr. Deep Kamal. National Vice President in the West region. Madam, I kindly request you to come forward. I request the South National Vice President South Region. I request Madam JDCAM from JDCAM to hand over to Madam Dr. Kupanjali.
Okay.
Now we want the National Vice President of North East Region, Madam C.S. Adapu, Professor Kodum Nandanadu.
This side में जा भाई अरे ना रुका है
From the National Treasurer of the Trainers Association of India, during the 6 years we doubled the budget. I hope you triple the budget in triple the money in coming year. Rose flower I'm giving because it is a beautiful movement and she has to smile, but they are from us.
Where is that man? Okay.
चले चालू करके साइड में है ये यार बार बार करना पड़ता है
Yes, this side.
National Treasurer TNAI. Honorary Secretary for ANM.
Okay.
Shantilakra. Once again, I really appreciate and thank you so much for the newly elected office bearers as well as the existing office bearers. And as I said before, it's a mixed feeling and so much of emotional things attached because we are so much, the entire headquarters also, all the entire headquarters have been so much associated with each one of you, the way you are taking care of us was amazing. And we had very wonderful experience with each one of us under the able leadership and each one of the Vice President, Treasurer and Honored Secretary of ANM, and during the period we have a conference also for them. And there is no words to express how we have enjoyed and we have worked together, even though we could achieve many things, but we never felt that we have overburden. And with the joy, with the enthusiasm, with the delighted face, we all have worked and together, and I hope we will continuously get a guidance from each one of you also, and we will also promise you that we will work together in the coming new week and take this association to a greater level. Thank you so much. Thank you so much. Yeah, we want to take a group photos like this because it will go into journal.
I would like to thank all my colleagues in the core committee and the National Executive Committee, and especially the full-time staff of the
TNAI headquarters New Delhi and Noida, led by Secretary General and other managing officers, and also entire staff. They all stood up with us. They really had a tough time with us. Maybe they must have felt time to calling, coming every night, and after the full day work and going back the night, giving them enough work for the next 2 weeks or 1 month. So they were with us. That's the reason why this could be implemented in time. So I shocked to them that they were never now at last told CRTC I could not do it, or if there is some task, we will do it. None of us that was their attitude. There's about 17 staff led by the our favorable efficient Secretary General who is her life is dedicated to DNA, and she will be here for another 5 full years, and we hope that we will be able to pass over the mentor of TNAI Secretary General post to another able nursing officer mentoring here and lecturing here. So definitely the association will go on special time. It was a very beautiful journey of 6 years and unexpected extension of 2 years. Of course, there was allegations that we purposefully did it. It was not purposeful. COVID was, I don't think it was purposeful by TNAI headquarters officer. So anyway, that resulted, same thing happened in the States also. Now it has come to a beautiful conclusion so that the next generation will take over and lead it more vigorously, more fruitfully, and more efficiently. And at TNAI, we feel happy that we hand over the chain and the power and the responsibility every 4 years, except this 6 years. And that, unlike many other organizations and institutions, where when somebody sits, they will sit for lifetime. So, that is the credibility of the TNAI. None of us are going to hurt it, it shall continue. New generations of leaders shall march on and march on. All the best to each one of you. It's one of the most gratifying moments of me as a TNAI life member. Thank you very much.
It's on the way. We have to wait for a few minutes more. Then, so we can take one photo. Proper nice photo. So to be on that. Proper nice photo on that. Photo on the. Where is the other?
सब वाले में सामने देखिए सब। ओके थैंक्स।
Bottom whatever you are seeing it today, and this all the preparation has taken place almost 6 months. We constantly in touch with Mr. Manish. He is the person who have behind, and for all the arrangements he has helped us, and we never lacked anything. He just will come and go. Sometimes we come, at least I think many visits are made from Delhi to here. We keep coming with the Nation Vice President of North Region, the co-chairperson, as well as the Private George, and other staff. Sometimes they come and see something, and you have done a wonderful job with money. I hope you all have enjoyed every vitamin, food and towel and all the things. And we have another medical management manager also. Yeah. Yeah, we are seeing him and all the people again work hard. So all the event management are here. Current always there. We will every moment we say keep changing the design, keep changing the design, keep changing the color, keep changing the some of the ideas, but still you all have done it wonderfully, and I hope they all enjoy the venue and beautifully.
We all enjoy it. Give a big clap.
Instead of all the things, and smoothly we could be able to conduct all the election. I know every bit of it. And on behalf of the entire India, as well as 34 branches, TNAI, the next officers, the election and executive of everybody to conduct your hospitality is really amazing, and we all enjoy. Thank you so much.
Thank you taken from the hotel management for us to the TNAI. Me are the outgoing president and Andy are the incoming president and secretary we will do the credit for the and dedicate to the success of this conference, success of TNAI in this conference. Thank you.
ठीक है अभी
पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Competition can collect their participation certificates from our TNA officials. Please contact Dr. Vijay Lakshmi, Project Manager of TNAI for your certificates. I repeat, please contact Dr. Vijay Lakshmi, Project Manager of TNAI for your participation certificates.
बस उठ गया आपका ना